Going to do long axis distraction of the mortise joint, long axis distraction of the subtalar joint, then A to P, P to A glide of the distal fibula, then I to S, S to I glide of the distal fibula, inversion, eversion of the subtalar joint, A to P, P to A shear of the mortise joint, A to P, P to A shear of the subtalar joint. Then we have tarsal metatarsal glide. And one phalange motion palp. Now for the knee, we're going to do A to P, P to A glide of the proximal tibia. A to P, P to A glide of the proximal fibula. Then I to S, S to I glide of the proximal fibula. Medial and lateral shear. Now medial and lateral collateral ligaments. And then internal external rotation of the tibia. Then patella motion. Then he's going to roll over for distraction. Two. Going to start out with hip extension. Then roll over for hip distraction. And then hip flexion. Then internal and external rotation of the hip. And finally we have posterior glide.
Roll over. No.
Now we're going to do the muscle test, starting up the glute medius test.
Resist.
And the navicular muscle test.
Guard resist.
And the quad muscle test.
Resist.
And the rectus femoris muscle test.
And resist.
And the tensor fasciae lata muscle test.
Resist.
Now we're going to assess the foot and ankle. Start off with the navicular. Then the cuboid. Then cuneiforms. And the metatarsal heads. And the talus. And the calcaneus. Then the phalanges. And finally, fibular head. Now we're going to do supination protocol, starting out with navicular cuneiforms. Then the cuboid. Then the metatarsal heads. And the talus. And calcaneus. Then the phalanges. And the fibular head. Then the alternative talus supine. And the great toe technique. Then he's going to roll over. Going to do our alternative talus prone on the table. And alternative talus prone with the knee flex. Now we're going to do a knee assessment. Then lateral and medial wrist extension. Then medial and lateral prone knee flex. Then we're going to assess and correct the patella.
Over.
Then for the hip, we're going to do the anterior femur, the wrist extension. Then the anterior femur with a posterior glide. And finally, we're going to assess and correct the hip with external and internal rotation.